I wish to welcome you to this first in the series of our webinar that will be taking place from now. There will be other ones in every month, and I'm hoping that all of us will be ready to participate in the process. And the speaker today is no other person than our able leader, Professor Aweda, with decades of experience in medical physics education, both in the country and outside. He's going to talk to us about medical physics education and training in Nigeria. His experience will be very, very important for the progress of the association. Thank you, Professor Aweda, for accepting our invitation to present this. And I hope we will all have a lot to gain in what he has to tell us. Thank you, and you are all welcome.
Thank you. Still going to read Prof's brief bio before he comes. Okay. Professor Aweda is a professor of clinical medical physics and a consultant medical physicist at the College of Medicine, University of Lagos, and the Lagos University Teaching Hospital. His academic career spans over 30 years, beginning from the University of Ife, now called the Obafemi Awolowo University. He has been the coordinator of medical physics postgraduate programs at UNILAG for 28 years now. Since 1984 till date, he has supervised over 180 MSc students, 6 MPhil students, and 11 PhD degree students, 2 of which are professors now. And currently, he's supervising 3 PhD students. He has published over 110 articles in 22 local journals, and 22 of them in local journals and 88 of them in international reputable peer-reviewed academic journals, mainly in the field of medical physics. He's a fellow of the International Atomic Energy Agency and has served on several technical committees of the IAEA and the Nigerian Nuclear Regulatory Authority. He's a member of several organizations like the American Association of Physicists in Medicine, the French Society for Hospital Physicists, and the International Organization for Medical Physics, where he's currently serving as the national representative. He's a force to reckon with in the field of medical physics, nationally and internationally. And in 2019, he was the recipient of the prestigious IOMP Award in recognition of his contributions to development and promotion of medical physics. Prof is the immediate past president of NAMP, and he currently serves on the board of trustees. He speaks French fluently. So this morning, we are happy to have you, Professor Aweda, as our speaker, and over to you now, sir. Thank you very much.
Yes, I was thanking everybody for giving me the honor to make this presentation, the very first one in the monthly series of a NAMP webinar. I also commend the leadership of NAMP, the current leadership of NAMP, for this good initiative. That is the initiative of a monthly webinar. It's a welcome development, and I pray and hope it's going to motivate our members and lead to development and promotion of the profession in Nigeria. So then I said that the presentation is not, the material is not completely new to us, and but a few things may, be a bit different from what we are used to. Yeah, but I'm optimistic that we are going to get some information, some useful information from the presentation. Next slide. All right. The presentation is going to be in this form, where there will be the introductory part, which is the part that we are used to already. Then the second part, we introduce some of the things explaining what I've just said now, that some of the things I'm going to say are the things we are familiar with, but some others are not too familiar to us, but they are not strange either. But they are not the common type in the common medical physics balance. Now, I'm going to highlight the need for link with the industry as professional, and also the need to collaborate, a kind of multidisciplinary collaboration, and probably lastly, highlight the challenges confronting medical physics education, the practice, and that's as peculiar to our country, Nigeria. Next slide. All right. Now, just by way of reminder again, medical physics is the study and application of physics principles, theories. Why do we need medical physicists in the hospital? Now, what the medical physics means, medical physics is the study and application of the principles, theories, and concepts of different specialties in medicine. It is application of all branches of physics in medicine. That is atomic and nuclear physics, radiation physics, mechanics, heat and thermodynamics, electronic physics, and then computational physics. And then who is a medical physicist? A medical physicist is a health professional with education and specialist training in applying the principles, techniques of physics in medicine. And the medical physicist is first and foremost a physicist with advanced or postgraduate training in physics in order to be able to apply the knowledge of physics. The clinical gone through a required academic programs and clinical physicists do. There are three major aspects of the services rendered. The first one is consultation. Now, medical physicists give scientific and clinical advice, which has a direct bearing on the management of patients. They apply scientific methods in maintaining the effectiveness, quality, and safety of diagnostic and therapeutic techniques. Medical physicists develop the cancer treatment plan and give scientific and clinical advice, which has direct bearing with the disease management. They introduce and advance on new procedures for the benefit of patients. In radiation oncology departments, consultation is indispensable in the planning of patient treatments for cancer using either external radiation beams, that is in teletherapy, implantation of radiation emitting isotopes inside the body, which is brachytherapy, or oral, nasal, and intravenous administration of radiation. So some indispensable services include the accurate measurement of radiation output from radiation generating facilities and employed in cancer therapy, patient treatment simulation and planning using a computerized system, precise calculation of the administered radiation dose to patients, safe management and use of radiation sources, and the protection of staff and patients against the deleterious effects of radiation, of ionizing radiation exposure. Now, they collaborate with physicians in the procedures using radiation sources and radiation facilities. They investigate the imaging and treatment equipment performance, organize quality control of the facilities, and they assure radiation safety and protection of patients, staff, and the environment. The second major aspect is in terms of research and development. Now, medical physicists plays vital and often leading roles in medical research. That is the medical physicist. His activities cover wide frontiers, including cancer, heart disease, and mental illnesses. In cancer management, he works primarily on treatment involving radiation, development and application of new high energy machines. He develops new techniques for the for the precise calibration and calculation of radiation doses. In heart diseases, medical physicists works on the measurement of the blood flow and oxygenation. In mental illnesses, he works on the recording and correlation and interpretation of bioelectric potentials. Now, next in teaching, often medical physicists, apart from hospital services, have faculty appointments at university and college of medicine, where they train future medical physicists, radiodiagnosis residents, nuclear medicine, and radiotherapy residents, train physicians, medical students, radiographers, radiation oncology nurses, medical and biomedical technologists and technicians who operate and maintain the different radiation emitting equipment and so on. Now, specialties in medical physics include radiotherapy or radiation oncology physics. So medical physics is the pioneering subject in radiation oncology. I remember in my department that medical physicists started radiotherapy at the College of Medicine, Lagos University Teaching Hospital in those days. So a qualified medical physicist possesses the knowledge and skills required to provide precise and safe use of different radiation for good quality cancer management. He also possesses the knowledge and skill to control performance of different imaging modalities for precise diagnosis of diseases. The second one, diagnostic medical physics. Now, development of the dynamic field of diagnostic medical imaging modalities is physics-based. Top of CT, computerized tomography, MRI, SPECT, PET, fluoro, mammo, and so on and so forth. So medical physicists ensures medical imaging facilities are optimal in performance and image resolution to achieve accurate diagnosis of diseases. He develops standards which result in improved image quality and reduced patients and staff radiation exposure risks. He develops and manages departmental radiation safety and protection programs. Now, the third aspect, which is nuclear medicine. Nuclear medicine is a technique involving intravenous, oral, nasal injection of radiation-emitting unstable elements. So fabrication of such elements from nuclear reactors, the separation and purification before radiopharmaceutical preparation are partly the jobs of adequately trained physicists. Therapeutic and diagnostic nuclear medicine procedures use naked radiation-emitting elements. So medical physicist is in charge of patient dosimetry. Radiation protection of staff and patients and the safe administration of naked radioisotopes are some of the responsibilities of the medical physicist. Now, concerning training of medical physicists in Nigeria, we all know already that in order to be competent in performing all the above roles mentioned, medical physicist is required to have a sound knowledge and experience, first of all in physics, and then in basic knowledge in anatomy, physiology, biochemistry, computational mathematics as listed above. The NAMP, our lovely association, in consultation with many foreign medical physics professionals bodies, has evolved a standard curriculum with minimum benchmark for the training of medical physics in the country. And the curriculum is expected to serve as the minimum benchmark for medical physics program or medical physics training. Now, apart from theoretical trainings, lectures, seminars, workshops, a clinical medical physicist is expected to be trained under a qualified and experienced clinical supervisor. And so, talking about the roles of the supervisor, what are expected of a clinical supervisor? The supervisor ensures resident is trained in all aspects of radiation oncology physics by implementing a structured training program, keeping with the guide and with the scope of modules and assessment levels to be completed as determined by the residency steering committee. It is the responsibility of the supervisor to ensure that suitably qualified specialists undertake the training of the residents in the various facets of the program. Now, he's supposed to meet regularly with the residents to discuss progress and adequate supportive and corrective feedback to the residents, such as the level of competency achieved and competency achievements which have fallen behind. That is yet to be accomplished. Providing a 6-monthly report on the residents' progress, ensuring that the residents' clinical training and performance is monitored, documented, assessed, and reported as required. Ensuring that the in-service clinical training is provided in a standard acceptable. Ensuring that the residents are placed in other hospitals where possible for short periods to gain experience in techniques and the use of equipment not available in the residents' own department. Now, ensuring that the residents have sufficient opportunity to prepare for all assessment required as part of the program, facilitating external assessments of residents during their training where possible. The clinical supervisors should be lifelong learners themselves, because technology develops rapidly in this field. And if a teacher, if a supervisor does not update his knowledge, after some time, it will become, his knowledge may become obsolete. It is also recommended that every clinical supervisor attends a training the trainer workshop, if possible, to understand the educational framework of the clinical training guide prior to commencement of training. Supervisors should reflect on what helped them learn during their own training and use their own experiences as one guide to providing the best practice in clinical training. Again, what does medical physicist actually mean? Just to emphasize, I've posted this slide before, I'm just repeating it for emphasis. Medical physics is the study an application of physics principles, theories, and phenomena in the different specialties of medicine. It is an application of all branches of physics in medicine, as listed below. In another word, medical physics is not all about the use of particulate and non-particulate radiations for diagnosis and treatment of cancers. It's a lot more than that. And that is the key thing I want to emphasize in this presentation for the benefit of all of us. Now, clinical application of other bands of electromagnetic radiation spectrum. Now, I want to give just a few examples to motivate us, and these examples will come from infrared radiation. Imaging with infrared radiation is called thermography, and we can use this radiation for diagnosis of breast cancer, diagnosis and classification of thyroid cancer, diagnosis of different types of skin cancer, thermographic diagnosis of sickle cell disease, which probably most of us may have never have had before now. We can use it by remotely imaging the portion of the patient and then using the Blaise-Diazy's relation as presented in 1997. And we can also do studies that are, or join the studies that are ongoing. In some quarters, studies are on the way using microwave radiation for the detection of breast cancer. By the time they get nice results, I'm sure we are going to get some of these better informed in their publications. Now, the next slide shows images of the first example I gave, that is using infrared radiation to diagnose breast cancer. That figure A shows the right breast cancer image, and the one on the left, that is B, shows that of the left breast cancer being imaged. Now, when we talk of thermography, thermal, the principle is based on measurement of skin temperature, from where the word thermal or thermo. Graph means picture, image, or graph. So thermograph, that is the image of the breast from the distribution of the skin temperature, we are able to diagnose breast cancer. Now, the details of the principle can be obtained from the reference in the list of references at the end of this presentation. Now, for the next, image shows the same image of the right breast cancer post-mastectomy, while the second image shows again the left breast cancer post-mastectomy. Now, what I want to call our attention to here is, if you compare the right breast cancer pre-mastectomy, you will see that the temperature, which is 37.6 degrees centigrade, is higher than the post-mastectomy, which is 34.8 degrees centigrade. The same thing with the left breast cancer, 37.7 pre-mastectomy and 34.1 post-mastectomy. Now, the next slide shows patient diagnosed with well-advanced breast cancer, to the extent that the breast was fumigating. Fumigating means it's issuing fluid, liquid. So now the right one, again, that is the right image, is that of advanced, another breast cancer, but well-advanced cancer that is already metastatic. Now, again, you can see the difference between the two. The next example I want to show here is detection and classification of thyroid cancers. And then where you can see the first image there by your left, the typical thermograph of the hyperthyroid thyroidic patient. Now, the focus of that, the point of measurement of the temperature is shown by the cursor, and we see that the temperature is 37.5. Now, the one below it, that's skin temperature of hypothyroidic patient. Maybe I should explain a bit. Hyperthyroidic means that the thyroid gland is hyperactive. The rate of metabolism is very high, exceptionally high. And then hypothyroidism is when the rate is the other way around. It is exceptionally low. Reason, due to the disease of the thyroid gland. And now the slide following shows the comparison. That is the variation in the temperature as a function of the type of the disease, whether it is hypothyroidic or hyperthyroidic. Then for thyroid that has no disease whatsoever, that one is used as control. Next is all kinds of skin cancers. Now, I've given just 4 examples here, though we have talked about thyroid disease before, which is the 4th image here, image D. But the first one is cancer of the skin called keloid. And the second one is, that is the one on the right-hand side, B, is the image of cancer patient, breast cancer patients, again, post-mastectomy. Now, for the third one, that's C, image C, is that of a patient with cancer of the cervix. Of course, like I said, we have mentioned that of D, that's a cancer of the thyroid. So we can see from here that the temperatures are different for different diseases. Now, next example, again, is what we are not so much familiar with, like I said earlier. I was surprised while going through these studies myself that it is possible to diagnose sickle cell diseases remotely. In fact, that is what it has to do, some biological tests, laboratory tests, and this and that, and the blood tests especially, to diagnose who is a sickler and who is not a sickler. But with a thermographic technique, you don't have to. All we need to do, from what that next slide is showing, you take the skin temperature as some specific location in the patient. So like we have seen here in 4 places, in the stomach, in the forehead, at the neck, and in the chest. Now, you just plug whatever be this temperature into the equation of the author I mentioned earlier, Blazejezik. Plug this equation into, do some calculations, and then the result will tell you that the patient is either a sickle cell patient or a non-sickle cell or a normal blood cell patient. The principle on which this is based is, we know when we talk about temperature, it has something to do with heat. And heat is as a result of metabolism. So because the composition of the blood is important in determining general metabolism in the body of the patient, it's a fairly complex process. And just with the other two, we can refer to the reference that I gave at the end of the presentation if we want to, if you are interested in the details. Because of time, I will go to the next, which is a use of ionic detectors for monitoring biochemical parameters, especially used in surgery. Here again, I have given 4 different examples. We have ion-sensitive glass detectors. We have metal oxide detectors. We have ion-sensitive field effect transistors, and we have gold electrodes that can be used for monitoring electric impedance or conductivity in physiological fluids in organ conservation. Maybe I should give a brief, give one or two statements to this for our understanding. During surgical operations, artificial ventilators are used. Artificial pumps replace the heart. And during the duration, during the process, it is necessary to monitor the biochemical parameters of the blood of the patient. So these sensors, which are very small indeed inside, in fact, they are called microsensors. You can insert this into the external extracorporeal circulation of the patient. This linked with a computer that will be monitoring the values of the concentration of these important ions in the blood. And so that, of course, there is a particular value for each concentration of the ions we want to monitor. So that while the value is going down, while the ion concentration is depleting, the computer can raise an alarm, call the attention, and some adjustment could be made. This is the idea. Now, but for the first one, this comes up where that is use of gold electrodes to monitor biochemical parameters in physiological fluids. Physiological fluids are fluids that we use to conserve organs. Let me give an example. Suppose at Ibadan, we have a patient that needs kidney transplant. It could even be heart transplant. But then the donor is way far away in Lagos or Kano. When the organ is harvested from the donor, you need to preserve this organ in a physiological fluid. Physiological fluid simulates human environment in the body so that the organ will still be conserved and be fresh when it's to be grafted to the receiving patient. And the figure you see below, that's the slide you see next, shows a typical example of experimental testing of these microsensors I talked about. We may not see the pictures very, very well, but now the patient here is not a human being. We use a sheep as experimental animal. Remove the heart, put extracorporeal circulation and ventilation, and then you can see the desktop that was used to monitor the different parameters. During this work, we are monitoring about 11 different blood parameters simultaneously using these microsensors. So let me just end it there. Now, what I'm saying from here is this: medical physics is not just its application of every aspect of physics in medicine, whether surgery, O&G, gynecology, obstetrics, ophthalmology, and so on and so forth. So now, medical physics and industry, again, needs to collaborate. We know that industries manufacture this equipment, industry manufacture radiation sources, and so on and so forth, which medical physics are involved in the use. And so we need to relate with industries for effectiveness. Now, what does the industry do? An industry is a body or organization that produces or manufactures goods, services for use or for sale. In the context of the current subject, some of the relevant industry types are nuclear industry that produces radiation sources, radioisotopes for clinical use in radiotherapy, brachytherapy, nuclear medicine, and diagnostic radioimmunoassay. Now, the manufacturing industry that produces high and low energy X-ray electrons and heavy ion particles, non-ionizing radiation-based machines, including ultrasonography for diagnostic imaging and treatment of diseases. There may be some other industries of interest, but let's just limit ourselves to this one because of time. Now, what are the goals of the industry? There are quite a number of manufacturers today with diverse designs. Thus, this creates high competitiveness among different manufacturers. The product manufactured need to produce, to process certain characteristics based on the expected uses. The manufacturers seek to satisfy the customer end users, hence they cannot work without consideration for users' interest. So the products manufactured in a competitive market have to strike a compromise between quality, performance, and pricing for effectiveness. Now, again, desired characteristic of diagnostic and treatment machines for clinical uses include the following. Now, because of time, I will not go through, or because we know these things already, and we can go through them through the details. Now, I want to move next to medical physics as center of interdisciplinary fields. Virtually all the fields of science are related to physics. All specialties of engineering originated from physics: mechanical, chemical, electrical, electronic, and so on and so forth. Even non-physics fields borrow principles from physics, and hence we have what we call biophysics. We have chemical physics, which is actually physical chemistry. And then we have biomechanics, which studies a lot of biomaterials used in orthopedic and other part of medicine. So medical physicists need to develop research interest in these different specialties with the aim to develop and applying the physics principles in the different fields of medicine. Doing this, we require interdisciplinary teamwork. And the next slide is just a funny, what do I call it now? That is demonstrating the role of the medical physicist as the center. You know, we have the industry, we have the radiologist, we have the nurse. When it comes to radiodiagnosis or radiotherapy, we also have a radiographer. But then the physicist is the one at the center of it. I'm just using physics to emphasize, trying to emphasize the importance of physics to us. Now, what is an interdisciplinary team? A group of people with complementary skills who are committed to a common purpose and value, achievement of goals, using diverse methods and approaches of which they hold themselves mutually accountable, or the members of this team are drawn from different specialized disciplines. Now, each expert applies his expertise and experiences to achieve the common goal of the team. So medical physicists' role and activities cut across several specialties and involve the teamwork. It is the main mechanism for truly holistic care of patients, sharing specialist knowledge and authority if the need of the patient can be met more effectively by other members of the team. From the technical point of view, interests of the manufacturer, the engineer, the designer of the machine, and the medical physicist may differ in some extent. In fact, they do differ often. So operational parameters and the level of precision of interest to the manufacturer may differ somehow from those of the users. Therefore, there is the need for interaction among all the stakeholders. So why interdisciplinary team is important? Just to reemphasize that, we need to develop clinical practice and guidelines that are evidence-based, consensus-approved products, quality-assured care, timely investigation and therapy, and increase of special skills with cross-learning, that is learning from one another. So with why multidisciplinary team is important again, to attain and maintain skills, attract more patients, quickly investigate and treat patients, consider enlisting in clinical trials, develop associated database, that is the result of the data, the outcome of the data, and the application too. Then integrate student teaching. You can use data for teaching students and the younger ones too, who are not yet, but are aiming to follow the profession. Advantages of the teamwork again, just to emphasize, each member of the team gets to understand the whole picture and participate in the decision making. So this causes increased job satisfaction. Now, able to deliver service in a planned and well-coordinated way, delivery of cost-effective service, enhancing information and streamlining work practices, all these to the benefit of our lovely patients. Now, why marriage between medical physics and other principal stakeholders? All diagnostic and therapeutic procedures are based on physics theories and concepts emanating from academia. All engineering principles for the design and production of medical equipment are based on physics principles. Clinical medical physicists use the equipment for diagnosis and treatment of diseases in collaboration with the clinical colleagues. There is a high level of interdependence among the trainers, machine manufacturers, and medical physicists as an end user. So now all the key players need to be united as a result of the common goals and common interest. Each stakeholder depends on the other to achieve goals, and none is less important than the other. There are mutual benefits for each, which can only be tapped through collaboration and union. So the overall effect of the marriage is patient benefit due to the optimal image and disease management quality. Now, from what I've been saying, we come to realize that the scope of medical physics could be very, very, very wide. And that is why in our journal, African Journal of Medical Physics, if you read the details of the field from where articles are invited, these are the fields listed below. It's quite a long list. I don't have time to go through all, but we can go through and see. Now, what we are saying from here by conclusion is that this presentation shows that medical physics is a wide field, and to be a competent medical physicist requires qualitative education. You see, we should learn how to communicate with the industry using their language, technical languages. We should learn how to communicate with the clinicians using their clinical languages, and using our own language in such a way that we mutually understand one another. Now, we also see from the presentation that actually medical physics involves more than use of non-ionizing radiation, of particulate and non-particulate ionizing radiation for imaging and cancer management. So full development of medical physics requires application of all the specialties of physics in different fields of medicine. A medical physicist, first and foremost, is a highly trained and experienced physicist. He therefore needs to be revising the basic theories and principles of physics with the aim, that's from time to time, with the aim to develop and research towards medical applications. So now the roles and responsibilities of medical physicists are enormous. That's the last slide now. And they are also challenging. So setting the standards, therefore, we require medical physicists to appreciate the scope and the challenges involved in the development of the profession. which we try to do in this presentation. Now, we also require high level of theoretical and practical competence. Research and scientific skill, determination and hard work, focus, wow. Yeah. Okay. Wow. Okay, I'm back. Now, determination and hard work, focus, self-motivation, and especially in a developing country like ours. Now, lastly, we have to defy all militating political, material, socioeconomic, infrastructural challenges that confront our education in Nigeria if we have to succeed, if we have to progress. Thank you very much for listening, and sorry again for the behavior of the network that caused some hitches here and there. Thank you so much.
Thank you very much, sir.
Yeah.
Thank you very much, sir. Thank you for, even in spite of the challenges, for keeping to time. And we apologize to everyone for the little hitches we had. Please, because of our time, we'll just take 1 or 2 questions. So I don't know if anyone has 1 or 2 questions for Prof before we round up for today. Do you have questions? You can just signify by raising your hand so that we can unmute you. Okay. Okay, I can see a question in the chat, sir.
Okay.
From you. So someone is asking, what significant advantage has infrared use in diagnosis of thyroid disease over gamma rays? Over gamma rays, yes, that's the question.
Yeah, a major advantage is that infrared radiation is non-ionizing, so it doesn't constitute radiation dose to patients. Okay. The only thing is that you see, thermography is not very popular, especially in this part of the world. So the radiologist needs to be familiar with the interpretation of thermographs. So a major advantage. Then number 2 is very simple, very cheap. To get the images I've just displayed, it's just like taking a photograph. Just like taking a photograph. So like I said at the beginning in my comment, that a thermograph is obtained, or rather a thermograph is the image of temperature distribution of the body. But then for the purpose of this application, we focus on the disease and get the temperature of the skin at that point, and then using the value, compare it with that of normal. We are able to see that patients with so kind of cancer have higher or lower temperature than normal, depending on the type of cancer. I explained where the thyroid cancer could be, the thyroid gland could be hyperactive, it could be hypoactive. And so to know which one it is, the higher temperature will show hyperactivity. The lower temperature than normal will show, will indicate hypoactivity. Do I answer the question?
Yes, I think you did, sir.
Okay.
Yes. Yes, you did. Thank you very much, sir. People are thanking you and saying it is rich lecture, it's a cerebral lecture. Yes, I agree totally with them. Please, does anybody have any other question? Okay, so someone is asking, sir, I think this will be the last question. Someone is asking if for someone who studied radiation biophysics, is there any shortcut for someone, for that person to convert to medical physics? You know, considering the challenges we have in the country. So most people who plan to study medical physics ended up studying other similar courses like biophysics, health physics, and the rest. So this person is asking if there's a short course for him or her to convert to medical physics.
Shortcut or short course?
Short course, a short course.
Study program.
Yes, yes.
That's okay. To the best of my knowledge, I don't know. I don't know of anywhere such course exists. Like I try to emphasize in the lecture, the knowledge of physics is very, very, very important. One has to be very versatile. This is why this program cannot run successfully as an undergraduate program, because you must be very, strong in physics. You are going to apply this physics in something. So you must be a master of what you are going to apply. Physics is the tool. You are equipped with the physics. You are now looking for where you can use this concept, this knowledge, this theory, these principles, where you can use it for the benefit of the patient. So first and foremost, the person must be a sound physicist. There is no shortcut to that. Otherwise, what is he going to apply? So that is the problem. Now, but when you are a physicist already, it is easier for you to apply to apply as biophysicist, to apply in various other areas. Why? Because you are first and foremost a physicist, and you are looking for ways in the biological area where you can apply these things for the benefit of patients. So I don't know of any shortcut. The first must be, first of all, be a sound physicist. Do I make sense? Do I answer the question?
Perfectly, sir. You did.
Hello?
Yes, sir.
Hello?
Hello, sir. We can hear you.
Yes.
I said you answered the question perfectly, sir.
Okay, okay.
Yes, you did. Thank you,
so
sir.
Any other question?
Well, I can't see any other one from the chat. Okay, so someone is asking, this is the last question, please, because of our time. This is the final question. Someone is asking if he or she can go for an MBBS degree after doing a master's in medical physics.
That would be at the discretion of the institution, because they have the criteria for admission into medical programs. Now, if it were, I know of US, you cannot go to read medicine unless you have a first degree. You first go for a first degree. Your first degree may even be in law. They don't care, but you must first have a first degree. Now, if you are already a medical physicist, you want to go into medicine, in fact, I can tell you, if you have the opportunity, please go. You know the reason? By the time you finish as a medical doctor, in addition to your medical physics profession, you will become a hot cake. And the way people will be inviting you, the way they will cherish you, the way they will, be hunting, running after you, trying to snatch you to their side, will confuse you. Let me use that language. Especially in developed countries. I'm not talking of Nigeria. In developed countries, they so much appreciate people with double professions. So if you have the opportunity, please go ahead if you can get admission. And by the time you finish, we see that you become a wonderful man, by a professional expert. And you will be in a better, virtually major aspect of medicine, major aspect of medical physics. So to practice medical physics will be very easy for you. You see, for some of us had to go and learn some things in medicine, biochemistry, physiology, and so on, in addition to the physics. But when you want to go through medical program, you will really learn these things. For example, you won't do physiology for less than 3 years. You won't do anatomy for less than 4 years. You won't do, which other one now? Biochemistry for less than 2 years. So you would have acquired a lot of knowledge in the medical field. Adding this one to your knowledge in physics, wow, you become a wonderful man. So please, the questionnaire, if you have the opportunity, go ahead.
Thank you very much, sir. Thank you very much, sir. And thank you to everyone who has attended the lecture today. I think the president is unavoidably absent, so he's not yet to round off the meeting. So on behalf of the president and the entire executive of the National Association of Medical Physicists, we would like to thank you, Professor Aweda, for honoring us by being our first speaker, the first speaker of this wonderful NAMP initiative. Yes.
Thank you very much.
Yes, we're really honored.
It's
and
we
don't mind if we invite you for a second part, because I see that you had to rush through your lecture because of the time. So
yes,
we would like to invite you maybe later on so that you can expand on those researches.
Okay, no problem,
Yes.
with pleasure. Yeah.
Yes, thank you very much, sir. And thank you to everyone who was patient with us till this time. Sorry for taking your time. We hope to finish at 1 p.m., but permit us, this is our first time. So hopefully next month we would have taken care of all the glitches. And I would like to announce that this continues next month. Hopefully next month, I think the 2nd or the 3rd Wednesday next month, we would announce on the platform when we have our speaker and topic. Thank you very much, everyone, for coming. Thank you, Professor Aweda. Thank you to all the experts.
Good afternoon to all.
Thank you, Dr. Ige, everyone who is here. Let me see if I can mention names. Okay, everybody, I can't mention your names, but thank you, everyone, for coming. Thank you so much. Really appreciate it.
As a people with one song, with one voice, we're a nation undivided and poised. We will take a stand and build our land in faith to defend what is ours. Here we are as a people with one heart for one cause. We're the time.